Screening and early detection are related. Screening is a process where we are intentionally looking for any kind of a medical problem before it causes any symptoms. So when we talk about cancer screening, you're looking for a sign of cancer before it causes any problems to the person while the person is feeling well. In terms of lung cancer screening, we are doing scans of the chest to look for small spots when a person has no symptoms, to find it early so that we can diagnose people when they're in those early stages and they have a much better chance of cure. Right now, low-dose chest CT scan or computed tomography scan, you may have heard this called a CAT scan, is a scan of the chest, which can look for any small spots in the lungs and the tissues around the lungs to find any early signs of lung cancer. So lung cancer can be detected early through screening with a CT scan of the chest. When we talk about screening, we also have to talk about who should be screened. People who are at risk for developing a condition are the people that we want to screen. Right now, because we only have a low-dose CT scan of the chest, it's not a perfect test. It's very good at finding cancers, but there are some downsides to doing it as well. So we only want to screen people for lung cancer who we know have a high risk of developing lung cancer. That's why screening for lung cancer is not recommended for every person. It's only recommended for older adults who have smoked cigarettes for a long time. And the way we came to those guidelines are from large clinical trials, large research studies that were done in the United States and elsewhere, which showed that compared to people who did not get a CT scan, people who were older adults who had smoked cigarettes for a long time and got a CT scan regularly every year, every 2 years, were less likely to die from lung cancer. So in one large study in the United States, 53,000 people were enrolled in this study in the early 2000s, and half of the people in the study had a CT scan every year. The other half only had a chest X-ray every year. In that study, we were reducing the number of people who died by lung cancer by 1/5 or 20%. That study was so successful, it was actually stopped early. So if the study had completed its intended duration, they probably would have saved even more lives from lung cancer. But it became very clear that screening was better than not screening. So they stopped the trial so that we could start bringing screening to everybody, including people who were not in the study. Another large study was recently published from some countries in Europe, from the Netherlands and Belgium. And again, they looked at older men and women who had smoked cigarettes for a long time. These two studies define that a little bit differently. At least 10 cigarettes a day, or at least 15 cigarettes a day for 25 to 30 years. And people who were aged 55 to 74 were in this study. And in the men who were included in this study who had regular CT screening, a quarter of the lung cancer deaths were avoided in the group that got screened. The results for women were even more impressive. In the group of women in the Nelson trial in the Netherlands and Belgium, who underwent screening with CT scan, a third of the people who died with lung cancer were avoided in the screening group. So the group that didn't get screening had more people die from lung cancer. So that's really powerful evidence that screening with a low-dose CT scan can help to save lives from lung cancer deaths.